Hi and welcome to my channel. I am Ayobola Boali, your baby's doctor, and today we'll be talking about asthma in children and the use of inhalers, how to use inhalers correctly. But before I go into that, I want to say a big thank you to you. I was just thinking about it today that this channel has been on for about 6 months now, and it has been nothing but pure joy. I have been enjoying the process of posting video week after week. Sometimes I'm tired, sometimes I just try to yes, I have to post this video, and I do. Thank you so much for stopping by all the time to watch these videos. Thank you for subscribing to my channel. Thank you for sharing the videos. I can see the changes. I see people telling me, yes, you said this in your video and I used it and I'm getting results. I'm so happy. There is nothing that makes me very, very excited as reviews, good reviews, and I'm very, very happy that we've been getting really nice reviews. Thank you so much for all you do for myself and my channel, and I pray that we'll only get better. We'll keep getting better. I'm bringing more content your way. Thank you so much for joining me. I'll be with you shortly. So today's video was actually a request by Ibukun. She said I should make a video explaining how to use the meter dose inhaler, which is what we're going to talk about today. But before I go ahead to talk about this, I would just like to briefly say one or two things about asthma, because of course that is what will lead us to talk about inhalers. So asthma is a chronic lung disease, which means it is there. For now, it is not exactly curable, but it is controllable, which is good news, which is perfect news for us. Alright, and you know, a lot of people when they come to the hospital, they're like, you tell them that your child has asthma, they're like, hey, asthma, no, God forbid, how can you say my child has asthma, this small child asthma and all that. And well, I just want to say that the earlier you accept the fact that your child is asthmatic, the better, because the earlier you accept the fact that the child is asthmatic, the earlier you're able to learn about how to manage your child's condition, and the earlier you're able to, create a conducive environment for your child and help your child survive. So please, if you go to the hospital, maybe your child has been coughing recurrently or has been having difficulties in breathing and all that, please, I understand, but please don't reject it. Understand, usually when your child is asthmatic, your doctor will try to explain, some do's and don'ts and all, but please sit down, listen to those things and jot them down, because that is a sure way of saving your child's life. All right. What causes asthma is that on a normal day, your body would react to something that is pungent, or something that, your body might react to something like, maybe let's just say you're frying or you're dusting your house. Usually you just sneeze once or twice. But for someone that has allergies or asthma too, because asthma is a form of allergies, the body would have an exaggerated response. It's like someone that is exaggerating, talking about a small bite, and he's talking about like a dragon just beats the person. All right, so that's like the same thing. Asthma or allergies generally are exaggerated responses by the body to a stimulus. All right, so that's something that we call a trigger that is actually triggering that reaction. Of course, anybody would react to some of those things, but when the person is allergic or has asthma, there is an exaggerated reaction. And some of the common, of course, there are a lot of things I can list a lot of things that can actually trigger an asthmatic reaction. But the common ones are dust, exposure to dust, exposure to smoke, exposure to fumes, so anything, fume, smoke, exposure to animal danders. Okay, so you have a cat, you have a dog, and then the fur irritates your nose. Some people is exposure to extreme cold, some people is stress, some people is even when they are emotional. So there are a lot of things that can trigger an asthmatic reaction, and everybody's trigger is the trigger is different from person to person. So each person has to understand what works for them and what does not. So for parents, usually when we are counseling parents about asthma, we have to tell them that, well, you have to find out what your child reacts to, and you have to remove all those things. So we call it environmental manipulation, in which you try to remove anything from your baby that can trigger an asthmatic reaction. Even sometimes the blankets, those furry blankets can actually cause or can trigger an asthmatic reaction. So you have to look for that particular thing that that each time a child is exposed to this thing, he will start running his nose, he'll start sneezing, the eyes will become red, he'll become itchy, and of course he'll start coughing and having difficulty in breathing. Then that is one of those things that you want to exclude from your baby's life. So environmental manipulation is the most important factor when trying to manage a child with asthma. All right, so in managing asthma, there are a lot of treatment options, but there is a particular thing that your doctor is likely to prescribe for your child, and it is an inhaler. Okay, so there are different types of inhaler. We have the ones that are short-acting beta agonists. Sorry for the long English, but there are some that we call the relievers, and there are some that we call the controllers. Okay, so this particular one, Ventolin, or well, to put it in other words, salbutamol inhaler, is a reliever. Okay, so when your child is having an acute episode, has just been exposed to something that triggered the episode, this will come in very handy to help your child breathe. All right, so I'll just be talking briefly. Like I said, I'm done talking about asthma. Maybe I'll make another video to go extensively about asthma, but since it's not a lecture, I just want to teach you how to use this, because that was what the request was, how to use the metered dose inhaler. Alright, so this is what we call a metered dose inhaler, in which each puff in this has 100 micrograms in this particular one. Of course, it might differ for different inhalers. Okay, so this is salbutamol sulfate. It's written there, and it's 100 micrograms per puff. Okay, so the first thing you do is check the expiry date and be sure that the expiry date is okay. Next, you open the mouthpiece. This is the mouthpiece. You pull it open and be sure that there is no creepy crawly walking in there. So you check and be sure, okay? And then you couple your inhaler like that, and then you shake. That's about 15 to 20 times. And then when you shake, well, for people, holding the inhaler differs. Some people hold it like this, some people hold it like this. I prefer to hold it like this because it's more comfortable. So whatever way you can hold it, so that when you press it down once with ease, you have your puff. So what do? You exhale completely. So which means you try to breathe out all the air in your lungs. And then when you finish exhaling, like, you put your mouth around the mouthpiece. I'll show you. You put your mouth around the mouthpiece here. And as you're taking your breath in slowly, you puff. And when you puff, you're still taking that breath in. And then you take it in. And then when you get to the peak of your inhalation or your breathing in, you hold your breath. And then you count down to 10. It's easy, right? Yes. Shake it. Breathe out. Put your mouth around the mouthpiece. Form a seal. Start to breathe in. Puff. Hold your breath, make a pout, and push it out. Did you get that, or do I have to do it again? All right, breathe in, breathe out. So that's what you do, and that is how to use your metered dose inhaler. So usually after using your inhaler, it is advised that you rinse your mouth. So you rinse your mouth, or you can gargle or spit out whatever it is that you rinse out from your mouth. So that way, when you breathe in slowly and you use your inhaler and you hold your breath, the content of the inhaler can go straight into your lower airway and do the work of opening up the airway. So that is how you use an inhaler. However, for children that are younger than 7 or even older children, sometimes I can use my spacer device, especially when I'm too tired to be holding my breath and all right, so you use the spacer device. So this is what the spacer device looks like. Okay, so it has this here, and of course this is the inhaler, this is the device, and this is the mask. Okay, so this is the spacer device, the mask, and the inhaler. So what do? You pick a mask that covers your mouth and your nose. This does not cover my mouth and my nose, so I'll go for the bigger one, which is this one, that covers my mouth and my nose and forms a seal around. So you couple your spacer device like this, and then there is this part here in the spacer device where the mouthpiece of your inhaler will go into. So the mouthpiece will go into this spot here. So you put the mouthpiece like this, and then that's your spacer device. All right, so you attach it to your nose, form a seal, let it cover your nose and your mouth, and then you puff, and then you continue breathing. Okay, continue breathing that way. So that is how to use the spacer device. It's quite easy, and usually for each spacer device, it always comes with an instruction manual that explains how to use. Like, this is the manual that came with mine, so it explains how to use your spacer device and how to also care for your spacer device, the things that you can do with your spacer device and the things that you cannot do with your spacer device. So it's actually nice if you have a baby, a child, a younger child that is, or even an older child. I like to use a spacer device because it's quite easy. All right, so if you have any one of those that that are asthmatic, it would be very nice for you to actually acquire a spacer device. You can get, there are different types, so you get a spacer device so that it can be easy for them to use each time they have an attack. All right, and the good thing about spacer device is that it helps to actually allow the medication reach, farther places than your inhaler would normally do, because the inhaler needs like a lot of technique. If you're not getting it right, you're not going to get the desired effect. That is why a spacer device should actually do well. I usually advise parents to buy about 2 or 3 inhalers. You have one at home, you have one that is mobile, maybe when you're going out, and then you have one in your baby's bag when your baby is going to school. So that way, your child would have adequate care the moment he develops symptoms of asthmatic exacerbation, like we call them, or attack, like they are commonly known. So it is actually advisable to have more than one inhaler. And then it is also very advisable that you inform their teachers in school and anywhere they go, like gatherings, about your child's health. Okay, so if they have any underlying illness, if they have asthma, if they are sickle cell disease patients, if they have whatever it is that your child has, allergies, especially food allergies, please inform people wherever you're taking them to, so that they will know that, okay, this child is asthmatic, and whenever he has the episode, this is what you are supposed to do for them, so that they can actually take care of the children while you are away. So I hope Ibukun have been able to help make a video on how to use the inhaler. Remember, shake, check the expiry date, shake like 10 to 15 times, breathe out. When you're breathing in, put the mouthpiece, form a seal around the mouthpiece. As you're breathing in, make a puff and take it in slowly. When you get to the peak of your breathing in, hold your breath for about 10 seconds. So you're counting down to like 10 with your hands, and then you breathe out with a pout. So that is how you use an inhaler appropriately. Also, I always encourage parents to also take their inhalers and spacer devices to the clinics whenever they are going there. Yes, if your child is asthmatic and does not attend the clinic, please look for an asthmatic clinic around and attend the clinic, so that they can first check the medications, see if they will need to add some more medications, see if they will need to reduce some things, or even make some modifications to the things that you have been doing before. So that's basically how to use an inhaler correctly. If you still have any questions, queries about this procedure, please hit me in the comment box below, and I'll be here to respond. If you want me to talk about anything, just hit me in the comment box below, and I'll be here to respond. So thanks so much, Ibukun, for this request, and thank you so much for joining this channel today. If it has been helpful, remember to click the like button so that YouTube can make it available for people everywhere to see and enjoy beautiful content like this. Thank you so much for joining me. I remain Ayobola Adebowale, your baby's doctor, shining light on your child's health and well-being. See you next time. Bye.